Hi David.
Hello.
Thanks for coming along today.
It's no problem.
You've agreed to show us how to set up and test the oxygen flow meter before patients' use. That's important for me because oxygen is obviously a prescribable medicine, the same as any other, but sometimes people don't know how to set it up and test it for use properly. So can you show us that?
Yes, I can. Well, the first thing I would do is I would look at the actual flow meter itself, look at its physical condition. I would be looking at the glass flow tube.
Okay, so what is it I'm looking for?
Looking for any cracks, any damage
so
whatsoever.
any sort of damage.
So these things can be dropped and they're susceptible to damage.
Okay.
So you're looking for cracks on the flow tube or on the actual body of the flow meter
and
itself.
And if it was damaged in any way, I couldn't use it?
Damaged in any way, don't use it, get a replacement.
Okay.
So I'm looking at this and to me it looks fine, it looks in good condition.
Okay.
So I would now connect it to the wall. So I would connect it to the oxygen outlet on the wall.
Okay, so the oxygen flow meter, would it fit in any of the other outlets?
The oxygen flow meter would only connect to an oxygen wall outlet.
Oh, so they're type specific?
They're type specific,
okay.
That's correct. So this is an oxygen flow meter.
So how does that then fit in here?
Right, well you would connect it with the flow tube vertical.
Okay.
And then you would just depress it kind of firmly into the outlet. And you'd hear a wee
click,
you can hear
that
catch.
Click. I heard that
tells you and then you would do a wee gentle tug test on the flow meter to make sure it's fully secured.
Oh, so that's important, the tug test?
Yes, that's very important, yes.
And if it wasn't connected properly, it would come out?
Yes, it would.
Okay, so what do I do now?
You'll be trying to hear for any kind of hissing sounds, any leaks.
Okay.
It's apparent, so I don't hear any leaks there.
So that means it's good to go? That means
it sounds as though it's leak tight. So I would then check the function of it, and you would do that by opening the control knob at the front.
Okay, and I can see the direction
watch the red
here.
ball going up the flow tube.
Yep.
Up to about 15 metres a minute to maximum.
Okay.
A couple of seconds at that, and close it back down again, and that tells me the flow meter's ready to go.
So that's the checks that I need to do?
That's the checks you need to do.
Okay, so I've got some oxygen tubing here. I've got a nasal cannula as if I was going to connect that to a patient. Can you show me then how I would set the flow rate?
Right, okay.
So if I connect this in here.
Okay. So I'm going to set the flow rate at 5 litres per minute.
Okay.
Right? So you do that by adjusting the control knob, and you watch the ball move up the flow tube. So
I can see that moving
up to the 5 litres mark on the tube.
Okay, so is it the top of the ball there?
Not at the top of the ball, you're looking at the middle of the ball.
The middle of the ball.
That tells you you're getting 5 litres per minute oxygen.
Okay, and that would then be ready to connect to my
patient.
So we're not doing that, so I'll switch it back off. And if we were then finished with it, I would get rid of this.
Yes.
What about this part here?
That's reusable.
So that
can
stays
come off,
on.
but you don't take it off. That stays with the flow meter.
Okay, I've seen it taken off for other devices,
right.
but we keep that
Generally,
and reuse
you keep that on.
Okay, thank you. What about then if I was to take this flow meter to a different bed space? How do I then remove it from the wall?
To take the flow meter from the wall, you would depress the wall outlet in the way.
Ah, see that collar moving there?
You hear the wee kind of click. That's the catch getting released, and then you can now remove the flow meter from the wall.
Right, so you don't just pull that
Don't just pull it out. You have to release it.
Okay. So the key things there that you've shown me is that when you're putting it into the outlet, you do that tug test.
Yes.
And then the ball comes up to the top for 2 seconds, so it's important that ball goes right up to the top and back down again. And then you read from the middle of the ball, when we're setting the rate for the patient. And then if we're needing to disconnect it, it's then making sure that collar is depressed to release the flow meter from the outlet.
That's right.
David, thank you very much. That's been very clear and useful.
No problem.